lesions of the brachial plexus. Brachial plexus injuries are usually a result of blunt trauma, producing nerve avulsions and disruption. When the brachial plexus is damaged, it requires meticulous clinical history taking and examination. The two most common clinical conditions that are related to the brachial plexus are the Erb's palsy and the Klumpke's palsy. The Erb's palsy is a paralysis of the arm caused by injury to the superior trunk of the brachial plexus. This lesion affects the fibers from the 5th and 6th cervical nerve roots. The most common cause of the Erb's palsy is dystocia, which means an abnormal or difficult childbirth. For example, this can occur when the infant's head and neck are pulled towards the same side at the same time, as the shoulders pass through the birth canal. This produces a widening of the head-shoulder interval. The paralysis of the deltoid, supraspinatus, infraspinatus, and biceps brachii muscles produces a characteristic clinical sign called waiter's tip deformity. Under such conditions, the arm hangs by the side and is rotated medially, and the forearm is extended and pronated. The other condition we're going to talk about is Klumpke's palsy. This is caused by a lesion to the inferior trunk, which affects the 8th cervical and the 1st thoracic nerve roots. This type of injury is also related to a difficult childbirth and can occur during a difficult vaginal delivery. The paralysis of the intrinsic muscles of the hand can cause the most severe physical manifestation of Klumpke's palsy, which is known as claw hand. Claw hand refers to when the affected forearm tends to lie flat and the wrist and fingers are tightened. Now that we've discussed these two syndromes, that brings us to the end of this tutorial on the brachial plexus. I hope you enjoyed it and thank you for listening.